right, hello, it's Dr. Crouch again, and I'm here with another splint with you. Now, what we're going to do today is an ulnar gutter with intrinsic plus. These are the splints that you're going to use for your boxer's fractures, your fourth and fifth metacarpal fractures. Now, it's important that you're not just putting a splint on the outside, that you actually bring the person down at a 90-degree angle at the MCP joint. The reason why you're doing this is this kind of simple diagram. We'll try and demonstrate. The metacarpal head right here is slightly shorter in the X versus the Y. So when we're discussing it, if you keep a person straight across, if this is your proximal phalanx, the area can be stiff. You want to bring all the ligaments to their point of maximum tension when you're splinting to prevent stiffness. The other reason, and the reason why I drew this across so you could see both of the positions of the proximal phalanx, is if you're at a 90-degree angle, you actually have something that you can grab and push up. So most of the fractures will occur just at this neck right here, right below. And if you split it like this, it can wobble a little at that neck. But if you're splinting at a 90-degree angle, you can put your thumb here, grab the finger and push up. This allows you to hold a good reduction and prevent it from going downwards, which is naturally what it's going to want to do. Okay, so let me go ahead and show you setup. Now, as we were saying with our other videos, the stockinette you don't have to have if you don't have them in the department, but it does help at the end to make especially the plaster look cleaner. If you take a 2-inch stockinette, cut it, split it across. You want it out just a little bit because you'll fold it over at the end. And then take your 3 or 4 inch, depending on the size of the person's wrist. You can slip this over, stop right there, and now you have a good coverage for where the splint's going to go, because the splint will wrap around here and go there. And at the end, you can fold this over and re-wrap a second layer on top to make it look pretty. After you've put on your stockinette, important to go ahead and put on some fluff. Remember, we're going to roll this way, so we're going to roll around so that we have a nice smooth placement. I would start about a half to 2/3 down the arm because this splint doesn't need to go all the way to the elbow. Hold a little bit of tension as you're putting it on, and it'll lay a lot smoother, at least a 50% overlap. And if you need to do a reduction that requires any degree of force, try and do at least 2 layers so that you have some padding. Spread your fingers a little bit. Thank you so much. Just wrap this over. So as you see with all of our other splints, the web roll and the fluff that you're going to do when you have a good padding on it will also make it look very bulky. And that's something to remember, that these splints are quite bulky. Now I pre-cut the plaster. I showed you in the prior videos how to measure, where you just take the fluff to measure the exact length that you want. But remember, plaster does undergo a little bit of shrinkage, which is more important for your sugar tongue splints. Make them about 1 inch or 2 longer than what you think they're going to need to be. It's okay to fold the edges over with plaster, not so much with fiberglass, because the plaster does lose a little bit of length when it's wet and when it's drying. And any carpenter can tell you, I've cut it 3 times and it's still too short. Basically meaning you can make things shorter, but you can't make them longer. All right, let's take our web roll back over. So this you're going to place around the fingers right here. Don't extend past the tip of the finger. And then you'll wrap it over here. Don't extend past your web roll. And across, sometimes having a second set of hands can make a difference, but it's not always needed. Optionally, you can put a layer of fluff right above your plaster. This will hold it down nice and flush and clean and prevent it from staining or bleeding through your ace bandage, which makes it look quite a lot less pretty when you're done. Your splint is like a Christmas present. If you do a crappy job wrapping it, people think that you didn't care about what's inside. So it's often nice to double glove for this part. It's up. And take this. And I'll show you what the reduction looks like, because I often like to do the reduction after I've gotten the plaster and splint going for these, because they tend not to require a ton of effort. So as you can see, this is a lot bulkier than if you had just used your orthoglass. And for the students out there, training physicians and PAs, I want to make sure that you take a little bit of time to practice these with both orthoglass and plaster, because you will frequently find yourself in a state where you won't have access to plaster, but plaster itself is better for these reductions because you can actually do a much better mold. And our orthopedists here basically only use plaster. So you can see how the stockinette gives it a nice, pretty appearance. Just wrap this up. You could have just done this with 2 of the 2-inch ones. And always secretly, as you notice in the other videos, I forgot to have this step ready for you guys, but a little piece of tape is better than using those little metal things. So when you're holding the reduction, you're going to bring this to 90 degrees, holding your thumb here, and place your thumb just proximal to where the fracture line would be across. And you're going to basically make an indent. So as you push up, push right there. As you're holding this position, your goal is essentially to be creating a small indent just above where the fracture line is, in kind of a persistent upward force to prevent the head from dropping down. I know this is a little uncomfortable and it's kind of weird to leave the patient with this kind of claw-like hand, but it is much better. I see a lot of people not do a good job at holding things in this perfect 90-degree angle, but if you take an x-ray, it should look like the picture I drew, where the proximal phalanx is going this way and the head is going this way, not kind of a slow arc or a halfway. Okay. Now I use slightly warm water, and we actually did this fairly quick, so the splint is already pretty firm. Okay. Always at the end, if it's looking a little messed up from the pressure that you've done, you can take a second ace bandage and rewrap over and make sure to clear the plaster off of the fingers. But that is essentially what a intrinsic plus should look like. And it's the perfect splint for your first metacarpal, fourth and fifth metacarpal fracture, sorry. All right, thank you.